You've come in for your consultation, you've met with my coordinators, we've agreed upon financial terms, and now we're ready to prepare you for your surgical experience. A lot goes into doing this before you get on this bed to have anything done. First, we need to ensure that you are in the optimal health that you can be in. We draw typically your blood work to make sure all of your blood work is in line. We review your medical history. If you have medical issues, we contact your medical doctor so that we can receive a medical clearance. Sometimes if you have a heart doctor, we also need a cardiac clearance. And once we get the green light to go ahead, then you meet with my tremendous nursing staff where they go over with you a long list of requirements on your part to be able to then come to surgery. I consider it a privilege to be able to go to surgery with you, but it's also a privilege for you to be able to be deemed healthy enough to have an elective aesthetic and cosmetic procedure. Because you're not sick, because this isn't cancer, many times patients think, oh, I don't need to listen to them when we have this long list of instructions. Wrong. It is very important that you follow all of our instructions. Anything and everything that we do for you is based on my bell curve of success over the past over 30 years in doing aesthetic, plastic, and reconstructive surgery. Preparing you properly for surgery is paramount to you getting a meticulous result. So at your pre-op appointment, you'll be given our information and our consent forms. Our pre-op packet is typically this thick, and it goes over with you all of the common and all of the rare potentials for untoward effects, for complications. My complication rate runs about 1% to 2%, which is typically below the country average, because we are so meticulous in preparing you for surgery. I pick my patients very carefully as well, because even though it's inherent for me to want to please you, you're still a walking example of what I do. Then comes the most exciting part of all of this, your day of surgery. You'll be asked to arrive at our surgery center typically 1 hour before your procedure, where my tremendous surgical staff, who've also been with me, most people have been with me for 10 to 30 years, both in my office as well as at my surgery center. And everyone at our surgery center knows how particular I am, and they respond in kind. So the nursing staff at the surgery center will prepare you for surgery. You'll be placed in a surgical gown. They'll start your intravenous. The nursing staff again will review with you what you're having done, go over with you the consent form. Then you'll meet the anesthesiologist. There's a pool of anesthesiologists that as well have worked with me for over 30 years. They'll come in and go over with you the potential benefits and complications of your anesthesia, and once again, ensure that you are properly educated. I'll see you one last time before we go to the operating room. I'm usually the hand holder as you go into the operating room, holding your hand while you go to sleep. And I'm there also then when you wake up to tell you how great you look, to go over with you how well everything went. Between the time that you go to sleep and wake up, a lot has happened, and it's all for you on that day. And then the next phase of our journey begins, the healing time. If you're having a facelift or if you're having liposuction of your body, I typically keep you overnight in our 23-hour stay facility where you are taken care of by one of our tremendous nurses or nurse practitioners. You go home the next morning, and then again, we see you back every day for the first week, once a week for a month, once a month for a year. So we're all in this process. We're here to take good care of you, not just do things to you, but I have expectations of you as well. I expect that you've read your consent forms. I expect that you follow all of our instructions to the T, and that you too are an active member in this team, because we're a team trying to give you the best possible result, and I have to be your coach through this, because many times patients, again, because it's an elective cosmetic procedure that you don't have to do, many times patients don't follow instructions because they think, it doesn't matter, I'm not sick, I don't have cancer. It does matter. All of the things we go over with you are paramount to giving you a meticulous result. So I look forward to meeting you, I look forward to taking good care of you and helping you achieve your natural best.